So here we go. So yeah. So this is a human brain, right? In a human brain, there is 100 billion neurons existing. Each neuron actually is connected to other neurons in what's called synapses. So synapses giving rise to about 100 trillion synapses in a single human brain. This computational power is actually incredible. It was always exciting for me, being a physician actually, studying the brain, studying neurology, as well as getting to the artificial intelligence, and that's actually what gave rise to the neural network. So the neural network is a science that was based actually on trying to resemble what's happening in a human brain. In TachyHealth, we take that forward actually and trying to solve some problems in healthcare, leveraging or cutting the bridge actually and the edge between the healthcare as well as the neural networks. So we know that healthcare is very complex. We have been studying this model for myself for more than 10 years. I've been in hospitals, I have been in management consulting, I've been also in startups for a couple of 3 years now. So, but overall, the idea is how you can pick the right problem that has a high impact through this very complex ecosystem, which is 10% of the global GDP. So that accounts to more than 7 trillion in healthcare spending across the world. So in this very complex ecosystem, there is providers on that side, there is payers, and there are research, there are academia, and there are also government regulators. So all of them are trying to serve one thing, which make people healthy and treat them, which are the center of all of this ecosystem, right? So to understand this, take it forward, since we are trying to focus on big challenges and solve them using intelligence. So we picked the provider side, which has a big problem actually when it comes to hospitals, healthcare systems. There are, as of today, there are 2 billion actually images are produced in the healthcare systems across the world, right? And those images are specifically what's called chest X-ray. So it's the cheapest, the most common, and the easiest actually to utilize in a screening or in a diagnostic area. So also, there are almost 3/4 of the world population, they don't have access to medical imaging facilities. That's a big number, that's account for billions of people. And as well as there is a huge shortage now in the radiologists specifically across the world. So in a survey that was conducted recently, last year, 97% of radiology department across the UK, they believe that they are understaffed, they cannot complete the reports on time. So when you go and do this X-ray very quickly, you wait a long time for the X-ray to be interpreted. That's definitely affecting the patient safety, affecting the quality actually of the healthcare as well. On the other side, which is on the payer side, we're having also a big problem now. There is shockingly 1 to 3 trillion US dollar each year is wasted across the healthcare system in the world. So we said that it's like 7 trillion actually is the total budget of healthcare across the world. 1 to 3 trillion is wasted actually on nothing. Administrative loss, repetition, and as well as fraud, waste, and abuse. So fraud, waste, and abuse means that for example, I went to a healthcare and I have been registered as a patient, and then actually this didn't happen. That's a fraud. Or waste, which means, for example, I'm prescribed things that I don't need actually, which is a waste. Abuse is slightly the same thing, And all of this is accounted to 10 to 15 to 35% of the healthcare budget across the world. Fraud, waste, and abuse is a huge problem. That means what we are spending money on nothing. We're just burning the money in the air. Also, in a recent interview conducted by PwC, 80% of the healthcare executive around the world, they know that the AI is the future. They cannot have a right capability to leverage problems solved by AI. So here we try to build our solution, which is one, it's called AiRay, Ray is image, actually, and the other side it's called AI Claims. So AI Claims is simply a platform that is built for payers. That is probably insurance companies, as well as third-party administrators and government, as well as the revenue cycle management people who are sitting in a hospital. What we're trying to use is leveraging machine learning so the systems try to understand what's happening on each single activity or each single visit, which is what's called bill or a claim, and then actually leveraging machine learning and trying to understand if this is a normal or actually this is a fraud or this is a waste or abuse. Our system has been trained on 2 million transaction, 2 million claim actually, as well as we are leveraging reinforced machine learning, deep reinforcement learning, which means with each activity that is, when this platform goes live with an insurance company, which each new detection, the system learns and catch that in the future as well. We have done some prototyping, and that's actually achieving up to 30% improvement in the detection rate of fraud, waste, and abuse. The other solution that we have developed as well is called AiRay, which is medical imaging software. As of now, it is for X-ray, chest X-ray, and it is again deep neural network. It is, as of now, it's 19-layer deep neural network. We have trained it on 100,000 X-rays. They are publicly available, but actually we are in the process of having agreements with hospitals to provide us things that are not on the public, to go to bone scans, for example. And what is different, we are capturing as of now 14 diseases. So pneumonia, nodules, fusion, all of this is captured actually. You can see now, that was funny one. So this one is not identified. No, this is not an X-ray. So our system knows this is not an X-ray. But overall, what we're trying to progress to as well is what we call end-to-end integration. The healthcare medical imaging is very fragmented. It is made of like radiology information system, what's called PACS, which is the imaging archiving system, as well as probably another system that's making interpretation. We're trying to take that to the cloud and make integration across all those systems to get to a point that everything is powered by machines the physician can support and agree on. We started also to develop the part of the back system actually, which is image viewing and all of that.